Hey, welcome, welcome, welcome. It is that time, Monday, 5 p.m. Eastern Time. It is Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help people, active people, hopefully people like you, feel, look, and perform your best regardless of age or injuries. This is that one time, one place every month where I will answer your orthopedic injury questions, surgery, recovery, rehab, regenerative medicine, regenerative orthopedics, peptides, exosomes, stem cells, that kind of thing. This is your chance to do this. If you are a veteran, you're welcome to watch. Love to have you. But if you have questions, disability claims, that kind of thing, the Veteran Nexus Letter live show starts in 30 minutes on that YouTube channel. So find the link that you would have gotten in the email or go to my Veteran Nexus Letters YouTube channel, click the bell to be notified when I start the live show, but that will start at 5:30. Now, if you do have orthopedic injury questions, this is the time and place. Leave those in the chat, not in the comments. I cannot see the comments. I can only see the chat. That's what comes through Restream, so please leave those there. I will answer as many as there are, as few as there are. Certainly happy to answer everything, but leave those in the chat. Also, please remember I am not giving medical advice. This is meant for general information and educational purposes only. I haven't seen you, haven't examined you, looked at x-rays, looked at MRIs, any of that. So I can only give information in a general sense, educational and informational purposes only. And I don't care what anybody says, it's illegal for anybody to do that in the United States for people watching or asking questions that are in a state where they don't have a medical license. I know people do it, but I'm not going to do it. I'm not going to risk my medical license to do that. So this is not in any way meant for medical advice. We got a lot of people on here, but nobody seems to want to ask questions. Which is certainly fine. Those of you that have followed me for years know that I have sort of pivoted from sports medicine, which is mostly arthroscopic surgeries of the shoulder and knee, taking care of athletes from the pro level to the youth level, but lots of trying to get people back as quick as possible. I've pivoted over the last 3 to 4 years to more regenerative orthopedics because I wanted to help people avoid surgery. And there's lots of reasons. I'm happy to talk about that, but largely it gets down to I think surgeries are getting more and more, to a certain extent, overdone. They're being pushed earlier as first-line treatment options, and surgery is not a benign thing in all cases. It's not risk-free, and so if you can help somebody avoid that surgery, that's a potentially good thing. And so I am a big believer in regenerative orthopedics. It's not for everybody. I would never push that. It's considered experimental by the FDA, and I certainly understand that. It's early in the research process when you compare it to some of the other things, but as I've talked about in a number of videos, a lot of the surgeries that we do in orthopedic surgery have never really gone through good research either. They got approved basically by comparing the implants to or procedures to things already done, not in randomized control studies to non-surgical treatments. And so I am a big believer in regenerative options. All right, John Tucker says, "Hi, Dr. Geier. How do you feel about PRP injections and injecting hyaluronic acid in the ankle?" So I like them both potentially. I will tell you, I'm less enthusiastic about hyaluronic acid than I am about PRP generally. The studies are not terribly great on hyaluronic acid, but it is covered by insurance. So if you try it and it works well, fantastic. You really have paid almost nothing out of pocket, potentially bought another 3 or 6 or 9 months of somewhat pain relief. That's always a good thing. The data on, and this is not specifically for the ankle, but just arthritis in general, more looking at knees or where most of the arthritis studies are done, PRP typically has better success rates in randomized control studies than does hyaluronic acid. I will tell you, I'm sort of lukewarm on PRP. We have a very, very fancy PRP system that makes billions of platelets. We spend a lot of money on it. I don't use it nearly as much because I've pivoted to other regenerative things that I think honestly work a little bit better, but I do feel that PRP can be a good option. It doesn't have the downside. Actually, neither PRP or hyaluronic acid the Synviscs and Suparts, and there's a variety of them. I don't mean to single those out, but they don't have the downsides of steroids, of cortisone, in breaking down or weakening the cartilage and actually potentially leading to faster progression of arthritis, faster progression of a joint replacement. So they're both better, I think, than steroids in that sense. But they also both don't have the immediate, quick pain relief a lot of times that steroids do. Usually only somewhat due to the steroids, somewhat due to the numbing medicine in it. But those are my general thoughts. All right. Beauty's Mistress, very nice. Hey doc, got a general question. 67 years old, worked at a computer for most of my life. Now when I sit for 20 minutes or more, it's uncomfortable when I stand up. Is this normal? Well, generally, no. I think pain is not normal no matter what. I mean, we're not meant to be in pain all the time. I would ask, my next question to that would be where it hurts. What is the area? Is it a leg pain? Is it a back pain? Things like that. But just in general, no, I don't think aches and pains are necessarily a bad thing. So, all right, we got tons of people here, but not many questions. It may just be one of these days. That is good because I can get ready for my next live show at 5:30. If you are a military veteran and have a disability claim and are looking for an orthopedic surgeon to write a nexus letter, perform a DBQ, those of you that aren't veterans are like, what in the world is he talking about? But if you are, definitely check out my Veteran Nexus Letter YouTube channel. I'm heading there and we'll be starting at 5:30 and we'll talk all things disability claims. But for those of you, all right, Beauty's Mistress got back to us. PRP injections are not first go-to. What's the latest and greatest? That's a subject of debate. I like exosomes personally. They are considered experimental in the same way that stem cells are. I think they have some benefits over stem cells that stem cells don't. And there are ways to get them from the patient rather than getting them from amniotic fluid or from umbilical cord, basically other donors. I'm not opposed to getting stem cells or exosomes from other donors. I think there are some concerns getting them from you in terms of how effective they are, but there's pros and cons, and I know there's all sorts of different regenerative treatments, and there's proponents of all of them. That's just my personal opinion. Jonathan Browning, hey Dr. Geier, love your work. Does BPC show up on a blood test such as high sensitivity C-reactive protein? All right, it's not going to show up on that. That is specifically a test for high sensitive C-reactive protein. If you're talking World Anti-Doping Agency and could it show up? Yes, in theory, and this really applies to all peptides, the ones that typically are tested for, if they're tested for, and that's a whole other discussion. It's going to be BPC, it's going to likely be CJC, plus or minus ipamorelin or tesamorelin or sermorelin, something like that, and thymosin beta-4. There may be a few others. The problem with testing for it, just so you know, is that they're out of your system very quickly, and so usually by the time of the test, they're already gone, for one thing. Now, I don't get terribly concerned about it if the doses that most people should be taking them, they're only minimally a performance aid. I mean, you have to take them in significant doses to get incredible Hulk size in the case of something like CJC or something. But having said that, could they show up? Yes, there are ways to test for them. I'm not aware of any job doing that. I don't know that many sports testing agencies do it. I only know off the top of my head, and pro sports are a little different because they don't actually release what the pro athlete, the NFL is what I'm thinking of, but what they actually tested positive for, leading to all the testing positive for ADHD medications. Yeah, right. It just cracks me up every time I see one of them test positive for Ritalin. Come on. But having said that, I am only aware of one football player that actually tested positive for a peptide, and the only reason I know it was a peptide is the coach made a comment about that he was under the impression it was a weight loss drug or something to that effect, which it's a whole other discussion about what different peptides do and all, but I don't terribly worry about blood testing. I tell people just know that yes, it's banned by the World Anti-Doping Agency, so if you're tested, you need to know that. the vast majority of the people that use peptides, that's not an issue. So, all right, that will wrap it up today. I very, very much appreciate, again, great attendance, good questions. Love to have more of them. I stay as long as as there are questions. I've gone close to an hour before, so I am certainly happy to do that. Again, military veterans, I will see you at 5:30 on my Veteran Nexus Letter channel. Otherwise, keep watching my weekly videos. I have some great things coming in the coming weeks. Leave your comments. That's where I get a lot of my ideas for videos. And I will see you back here June 2nd, Monday, June 2nd at 5 p.m. Eastern. Have a wonderful rest of your day, and I will see you soon. Take care.